Excellent. And so my name is Kara Kaikini, and my pronouns are she, her, hers, and I'm the board president of the Maine State Breastfeeding Coalition. I'm based in Freeport, and I'm excited to see you all today. So again, getting familiar with your Zoom buttons, and it's really great to be able to see faces. If you're able to turn your cameras on, that's great. Certainly don't need them on during the presentation, though I know as a presenter, it's nice to see faces while I'm presenting, but definitely in the second part of the meeting when we're doing connecting the dots and really having that networking and connection part of the meeting, it's great to have cameras on if possible. So excellent. Thank you. If you haven't introduced yourself in the chat box yet, please do. I'm going to start sharing my screen so that we can see the agenda and go over that briefly. So starting with our mission, the MSBC is a welcoming and broad network of people supporting families who value human milk and breastfeeding. Together, we work to enhance the culture of breastfeeding and chest feeding around the state through advocacy, education, and connection. So we recently updated that in the last couple of months to include chest feeding and to use the word connection now, since we do that in a variety of ways. So I will go over a brief board of directors update in a moment to share what we've been doing on our end, what's been going on for us. And then at 1:15, we will hear from Dr. Mangalam, and I will introduce him at that point. We'll hear what I believe will be a really interesting presentation about osteopathic medicine and lactation. And then that second part of the meeting is the connecting the dots and new knowledge worth having portion where Amanda will facilitate, essentially kind of go down the list of attendees and give you each a chance to share what's going on in your part of the world in terms of anything that's happening in your workplace that you want to share, that you think that the rest of us could learn from or would benefit from knowing. Any challenges you might be having in your work that we could support you with. Is there anything happening legislatively or you'd like to see happen legislatively? Any new research or anything that we can all help each other with and learn from. And then we'll wrap up and talk about 2023, which is somehow right around the corner. Any questions before we get started? Again, you can use the chat box at any time. And all right, so next up is our board of directors update. And I will share that we're always looking for volunteers and to help with our committees. So our committees have been busy and they meet once a month, if not more than that sometimes, based on what we are focusing on. And our advocacy committee has been focused on paid leave. So we are part of the Paid Leave Coalition of Maine. And Hannah Lord is here, I believe, and I think she's going to give an update on the latest with paid leave in the state. And I can help fill in some dots as well in the second part of the meeting. Hannah can also speak a bit more about access, our role in trying to improve access to doula care around the state. We'll be having a meeting next week with a number of different organizations and doulas to talk about ways that we could potentially increase doula access, and that might involve legislation that is related to that would make Maine Care cover doula care, or it might mean more education around the state. So we'll be talking more about that. We've also been working with the Mother's Milk Bank Northeast. I don't know if we have any representatives here from that organization. We've been working with them on some scripting that we will soon be sharing with folks if they want to call their own private insurance companies. So Maine Care will start covering donor milk next year. That is the plan, and we're trying to get some updates on that. But for folks who have private insurance or even have Maine Care as well, if they want to make their own phone calls to their insurance companies and ask, let them know that there's a medical reason for this nutrition for their baby, then we have some scripting that they can use and some information. So that's like a sample letter that we'll be sharing out. Our events committee will be talking a lot more about our Patchwork of Parenthood event that is coming up on May 13th. 2023 at One Longfellow Square in Portland. So save the date for that. If you are familiar with this event and you know that you have a story you'd like to tell, or you know someone who would be a great onstage storyteller, then let us know and be ready for a call for stories in the next couple of months. Our workplace committee is continuing to talk about workplace toolkits, and that would be a downloadable toolkit for employers and a downloadable toolkit for employees to offer some education and resources for making that transition back to work a little bit easier for lactating parents. So stay tuned. If you want to be a part of any of these activities, let us know. And we also have, some of you might know Pam Tozier, who is a lactation consultant at Maine Medical Center. Her daughter, Allie Tozier, is a workplace law attorney, and she is going to be doing a webinar in April all about what are we titling it? All about workplace law and any other sorts of policy that is related to lactation, that would support lactation folks. And that's also going to be a similar panel that I'll be facilitating at the BEST conference, which is May 11th and 12th, 2023. Still developing that, but it's going to be focused on folks who have benefited from policy or law that supported them in their lactation journeys, or folks who could use more support in that regard. So stay tuned. And then our DEI committee has been busy as well. They had put out a call for interest for a book club. And that book that will be read as part of that book club is called If These Ovaries Could Talk. And so the committee read that book over the last 6 months or so. And it's a really interesting book, really easy read. And it's one that we would love to make available as a book club statewide. So I'd recommend checking that out and considering signing up for that. Once we have some interest, then Petricor will be putting the word out to save some dates for that. Let's see, and we have a communications committee as well that, the DEI, I'll get back to that in a second. The communications committee is focusing on our website and our blog posts, our newsletters and social media, and Grace Cook is here. She's helping a lot with our social media. Robin, I'm not sure if she's joined, but she's helping a blog post. We always have room for support. If you want to write any blog posts or know someone who would be a great blog post author or have a topic that they'd want to talk about, just let us know. And our fundraising committee is always thinking about ways that we can continue to support our organization financially. So you may have seen that we have we've also put out this week during Giving Tuesday, a call for some donations. And so I would encourage you to consider that yourself, or to consider raising money for the Maine State Breastfeeding Coalition. You may have seen some Facebook fundraisers if you're connected to any of our board members on Facebook, and that is to support a lactation education access fund. So the DEI committee has been working on this, and our goal is to raise $2,500 to make it possible for 3 Maine residents within the Black, Indigenous, and people of color and LGBTQIA2+ communities, so that they can better support their communities, the breast and chest feeding folks in their communities. So the link that I had put in that email out to the MSBC the other day happens to be my Facebook fundraising link, and you can use that. It's a public link, or you can donate to anyone, or you can simply donate to our PayPal charity page, and that is all appreciated. I know this time of year is really tough because you're probably getting bombarded with lots of emails and mailings asking for donations, so I understand that, but you're here, which means this is something you feel really strongly about and you appreciate our organization, so that is appreciated all its own. And that fourth way you can donate is through time. So if you are interested in donating your time as a volunteer, then please let us know. Any questions before we switch over? Or any other updates from board members? Anything else that I may have missed? Well, welcome. And again, if you're just joining us, then please enter your info in the chat box. So we've been sharing name, pronouns, organization, town or city, and it is so nice to see everyone here. So we are just about at 1:15, actually a minute ahead. And I want to welcome Dr. Kiran Mangalam, who is here to talk about osteopathic medicine and its impact on babies and lactating parents. So Kiran grew up in Pittsburgh, Pennsylvania, and studied biopsychology at Vassar College. And from there, he began a lifelong study of yoga and Ayurveda, which eventually led him to fall in love with osteopathy. He earned his medical degree at the University of New England College of Osteopathic Medicine, where he also completed a teaching fellowship in anatomy and osteopathic manipulative medicine. Subsequently, he entered family medicine residency at Maine Dartmouth Family Medicine Residency, and upon graduation, practiced family medicine with obstetrics in Arcata, California. The allure of Maine brought him back east to practice outpatient family medicine and completed a neuromusculoskeletal medicine residency through the University of New England. From there, he joined the faculty at Maine Dartmouth, ultimately serving as residency director for their osteopathic neuromusculoskeletal medicine residency. Since just before the pandemic, his focus has been teaching osteopathic manipulation to medical students as an UNE COM professor. Kiran is board certified in family medicine, integrative medicine, and neuromusculoskeletal medicine, and focuses his clinical practice on peripartum and newborn issues at Maine Mother and Company in Brunswick, Maine. And when not seeing patients or teaching, you can find him hanging with his wife, his kids, and his dogs. So thank you so much for being here.
Thank you for having me. I'm going to see if I can share my screen. Oh, we want this one. Is that visible to everyone, my PowerPoint?
Yes.
Okay.
It's not in presentation mode, but.
Oh, thank you. Let me put that in present.
Perfect.
Okay. So yes, thank you for inviting me to talk to you a little bit about osteopathy and the work that I do. I can get the screen to go, sorry. Just a disclosure slide saying that I don't have any disclosures. I work for the University of New England, and I have clients at Maine Mother and Company, and those are the only people that give me money. And if there's anything from my slide presentation that you would like to use, feel free. So just a little bit about osteopathy itself. Osteopathy, there are two forms of medicine in the United States that people think of as sort of conventional medicine, allopathic medicine, and then osteopathic medicine. And the reason that I was so drawn to osteopathic medicine is that it has a philosophy that makes it a little bit distinct from allopathic medicine. And the philosophy really focuses on four ideas that the human being, whatever age they are, is a unit that is comprised of a body, a mind, and a spirit. And so looking at a person holistically, which is the way that all healthcare really should be, is the main focus of osteopathic medicine. Also, this understanding that the human being has within itself the ability to be self-healing and self-regulating, and that structure and function are interrelated, and that any treatment that we give to someone really needs to have all of these principles at its core. And so philosophically, going into any sort of encounter with another person with this philosophic basis really is the crux of what osteopathy is. Many people will think about osteopathy as being specifically manipulation, but in reality, it's a philosophical approach to care, and doesn't necessarily have to involve manipulation. But a lot of what I do actually is involving manipulation. So the basis of manipulation is this idea that the musculoskeletal system sits as as the core or the hub of how the human being interacts with its environment and even with itself. So by addressing the musculoskeletal system, we can address posture, motion, behavioral adaptation, neurologic balance, metabolic balance, and the circulation of fluids. All of these 5 functions together then help the human being interact with the environment, whether it be getting nutrition, fighting off infection, dealing with trauma, or dealing with social interactions. So this is all to say that in an osteopathic approach, we're trying to address all of these things, and the inroad that we have to addressing all of these things is through the musculoskeletal system. So then the question is, how does this apply to infants and to adult patients and caregivers? So in terms of infants, you all are very knowledgeable about infants and breastfeeding, lactation. And just to recall that the infant, the skeletal system of the infant is quite different from ours. We have many of the same structures, but they are not connected quite in the same way. The skull of the newborn, the bones are not fused together. They are quite movable and malleable, which is great because that does allow for a much more, it facilitates the birthing process, with the head being able to be changed in shape so that it can fit through the birth canal. But this also creates some difficulties because a lot of the nerves that are involved with breastfeeding, specifically with suckling, latching, they emerge from the head right at the base of the skull, where it attaches to the neck vertebrae. And that first neck vertebra, where the first neck bone attaches to the occipital bone, that's where the bulk of the nerves that affect suckling come out from the brain. And that area is also where the greatest amount of forces and tension forms during a vaginal delivery. So in the approach that I have to treating newborns, a lot of the focus is spent on normalizing the tensions that are in this area. So I just wanted to put up a picture of you can see in this picture where a delivery is happening, how much strain can happen in the neck and the head from that birthing process. And so the idea behind the treatment is to do very gentle manipulations of the infant, the head, the junction between the head and the neck, and the continuation of the neck down the rest of the spine, so that these structures are not impacting suckling behaviors. So this is where the video is not going to work. So let me just change this one up. And this is just a short video that will show you a little bit about what the osteopathic manipulation. This is a much older, this is like a toddler, but what newborn manipulation can look like.
Osteopathic manipulative treatment can be safely and easily applied in the pediatric population, including infants. In this video, we'll demonstrate a technique that may benefit the treatment of infants. It's called condylar decompression. Condylar decompression is the release of the occipital condyles at the base of the skull. In a newborn and infant, the condyle is in 2 parts and is surrounded by cartilage. Distortion of these parts, along with numerous muscular, ligamentous, or fascial connections, may cause compression or irritation of the hypoglossal nerve as it exits the hypoglossal canal. Other cranial nerves in this region include those that exit the jugular foramen, which is comprised of the articulation of the occiput and temporal bone. This includes cranial nerve 9, glossopharyngeal, 10, vagus, and 11, accessory. Irritation or compression in these cranial nerves may contribute to a myriad of symptoms, including colic, reflux, feeding dysfunction, torticollis, plagiocephaly, and constipation. Though demonstrated on the pediatric patient today, this technique may also be utilized in adults. This treatment is performed by placing the infant or newborn supine while the physician sits at the baby's head and cradles the head in the hands. Curl your fingers around the craniocervical space so the ring fingers lie on the approximate plane of the occipital condyles. Index fingers may monitor the mastoid region of the temporal bone, and middle fingers may be used to stabilize and balance the atlas from the occiput. Use your ring fingers to induce a gentle but firm lateral and posterior spreading motion. This motion spreads the tissues away from the atlas and helps to decompress the condyles. Maintain this position until the tissues soften or the range of motion improves between the occiput and the atlas. You may note that one side will release before the other.
So, that's an example of what can be done in the newborn. And as you can see, that the treatment is very gentle, but there can be quite profound effects on suckling behavior. And then also with some of those other conditions that were mentioned, torticollis, plagiocephaly, reflux, and constipation also can be treated with osteopathic manipulation. And then in addition, I also wanted to just point out that there are things that can be done also in terms of lactation for the adult patient as well. So in terms of improving the lymphatic drainage of breast tissue, of also improving just circulation for adult patients, and also improving postpartum pain. There's a number of my patients that I also see in during pregnancy itself, patients that have pain or that are having other medical conditions that are impacting their pregnancy. I can help with that in many cases. So just in terms of giving you an idea of what that looks like, let me just show you a little bit of what I don't practice hospital OMT anymore, but I used to work at Maine Medical Center and then also at Maine General, where we did inpatient manipulation. And so there in the postpartum period right after delivery, we would treat patients in the hospital. Now I'll treat them as outpatients, either during pregnancy or in the postpartum period.
Hello, my name is Dr. Sheldon Yao, and we're going to be demonstrating how to approach a postpartum patient. What I'd like to do first is to address the thoracic inlet first. Most times postpartum patients have a lot of edema. So in treating the thoracic inlet, we're helping to improve lymphatic drainage. I'll usually come over to the top of the bed, find the first ribs, and keep my fingers gently over the first rib and the shoulders, and apply a little gentle lateral traction. And this helps to open up the thoracic inlet and allow for improved terminal lymph drainage. Usually holding this for 30 seconds to a minute will allow the tissue to soften up and help remove any restrictions to lymphatic drainage. From here, since I'm up by the head of the bed, I'll get my fingers underneath to the suboccipital space, treat the OA, and treat the suboccipital region with a gentle suboccipital release. This is a very gentle technique, and it helps to treat the OA, helps to address any parasympathetic innervation, any restrictions on the vagus nerve. And again, just holding this till I feel a softening of the tissues. I like to come down and then do some articulatory technique on the cervical spine and on the soft tissue of the cervical spine on both sides. And then continue my way down into the thoracic spine and looking at the rib cage. A lot of times there may be regions of facilitation, especially the upper thoracics, sometimes the edema, sometimes from the increase in strain during labor. there might be a lot of musculoskeletal restrictions along the entire spine. So getting your hands underneath, performing some gentle paraspinal inhibition, some rib raising where I'm just lifting my fingers anteriorly and adding a little lateral traction. This helps to disengage the rib cage and soften up the muscles underneath my fingers. A lot of times you'll find increased restrictions along the thoracolumbar region, so kind of getting your hands in that thoracolumbar region. Sometimes you get your fingers midline and apply a superior lift just along the spines, and that's going to help the different junctions. I like to look at the 12th rib and make sure that the posterior attachments of the diaphragm aren't restricted. And it's important to really look at the hip and how the psoas muscle attaches along the lumbar spine into the hip. Coming underneath the lumbar spine, I'll apply the same paraspinal inhibition to release any restrictions along the lumbar spine. And then coming midline, I could treat the sacrum. In our study, what we found was that a lot of our postpartum patients had a lot of lumbar single somatic dysfunctions, some type 2 dysfunctions there, bilaterally flexed sacrums, and a lot of SI dysfunction. So using some very gentle techniques, we were able to decrease some of these restrictions and allow for improved musculoskeletal motion and movement. I like treating the SI joint by getting my fingers medial to the innominate into the SI joint, and I'll take my hands, and usually what I'll do is just internally rotate the hip till I feel that SI joint gap. And I'll hold that until I feel a little bit of a release underneath my fingers. Another way to treat the hip and the SI joint is to articulate the hip by slowly taking the hip and placing it into flexion, abduction, and external rotation, and I'm compressing through the knee into my monitoring hand in the SI joint, and then I'll alternate that with flexion, adduction, and internal rotation. So it's doing a Faber and Fadir motion at the hip to try to increase motion into the SI joint. By utilizing OMT in a postpartum patient, we could help try to restore the patient's natural musculoskeletal structures so that there's improved functioning in lymphatics and decreased restrictions on the nerves and improved mobility to help decrease pain.
So, so those were two videos that kind of showed you a little bit of what I do when I treat both infants and adult patients. So primarily the work for most of my week is teaching down at the University of New England in Biddeford, but on Fridays, that's where I do see patients at Maine Mother and Company in Brunswick. And for those of you that are not familiar with it, it's a great organization, a sort of coalition of a number of different practitioners from different backgrounds: postpartum doulas, lactation consultants, social workers, physical therapists, that all share space there, and we treat families, expectant parents, and their newborns afterwards, and sort of kind of really treating the whole family of folks surrounding newborn care. It's a wonderful opportunity, and I've been very thankful and blessed to be able to work there, and great group of people to work with and great clients that we have. So I'll stop sharing, and I'd love to, if anybody has any questions, I'd love to.
Yeah, it looks like Shauna just asked a question. Shauna, do you actually want to unmute and ask verbally, or I can read it out loud as well, but if you have more you want to add to that.
No, I can unmute. Those were awesome. I work at Eastern Maine, so I work with the residents that come up, and I wish more of them did more hands-on with the patients. It seems like when they come to labor and delivery, they're there to get their OB done and get the number of deliveries they need to do. And a few of them plan to do it as part of their family practice when they leave. But I just feel like so many, patients could benefit from a little bit of hands-on after the delivery.
Yeah, absolutely. That's one thing I definitely miss is being able to do inpatient work. I've offered myself to the Mid-Coast Hospital, but they haven't taken me up on that.
Yeah, we have a lot of nurses right now that work a lot with physiologic birth and doing a lot with our patients before and during labor. But then we send them to postpartum, so we don't get to do a lot with them. And unfortunately, our residents don't seem to do anything unless a problem arises. So
Yeah.
I just don't know what can we do to encourage them to be more hands-on.
Well, I part of the problem, at least when I used to run the hospital service at Maine General, the big problem is we have to get consulted. So unless they are our patients to begin with, we can't go in and do anything with them unless one of their physicians or one of their providers actually asks for us to be involved. So it's a tough thing where I agree. I feel like we should get our hands on everyone, but it's still the way our medical system is set up. You have to be asked and consulted to be able to be involved in a patient's care.
Sure. As lactation, we do get them involved with a lot of our babies that may seem to be having some problems with latches and things like that. And they're very receptive and come over and do some work with our babies for that. So that is good. Thank you so much.
Yeah.
Other questions? Well, I had a question and and Jen has a question. Thanks for raising your hand and for the applause.
Well, yes, I did both. I guess my question is, like, I just this week had a mom that has an appointment today with osteopath for manipulation. About how many treatments do they have to go through in order to have like relief from torticollis and latching and that sort of thing? Like, is there like a roundabout visits?
Specifically newborns?
Yes, this is a newborn.
Yeah. So that's a tough one because it really depends. When I see a patient, I don't usually set up a sort of treatment regime. Every time they come in, sort of as a new opportunity, I guess. So I will do a treatment and then try to do phone follow-up within the next 3 days usually. So I see patients on Friday, so I call them on Monday and try to see how the weekend went, and then at that point make a decision whether or not I'll see them again, whether or not it'll be necessary. Often with newborns with feeding issues, usually it's just one visit. Maybe there might be needing a second visit, but usually if things have not improved by that second visit, I don't know that I'll be able to help them. That's basically what I say. For torticollis, that's a slightly different issue. And sometimes that does require maybe 3 or 4 visits.
Mm-hmm.
I see some patients, some newborns with plagiocephaly, and sometimes that can take even longer. And if that does take longer, then I'm often involving some other folks, either PT, or they might even be eligible for using a helmet, an orthotic helmet. In that case, I'll continue to do OMT or I'll continue to follow the infant. I may not do manipulation regularly, but I'll follow up periodically to see where it might be appropriate. But every visit, I make the decision and evaluate whether or not I'll actually do manipulation. And sometimes I don't. Don't do manipulation is what I mean to say.
Thank you.
So I'm curious how many folks here know who they would refer to for this kind of therapy for their babies, and how many of you are wondering or saying, this sounds really great, but I don't know who in my area does this. You can either unmute or write in the chat box, but I'm wondering, Dr. Mangalam, if there is like a resource directory or something, if someone is in, let's say Bethel or somewhere, and they don't know who in their area does this kind of treatment, how would they find that out?
For all of you, please feel free to, you can email me. I think I have my website up, and you can email me through my website, and I'd be happy to help you. The other resource is the Maine Osteopathic Association. You can be in contact with them and find out where, if there are members who practice manipulation who are in your area. The Maine is small enough, and with my involvement here in the state, I think I'd be able to direct you. The issue is most of the people that do a lot of manipulation are centered down here in the southern part of the state. But with that said, you know, the only medical school that is here in Maine is an osteopathic medical school. So here in Maine, we have about 1/10 of the physicians that charge, you know, do billing through CMS, through Medicare and Medicaid, practice here in the state of Maine and the whole country. So that we do a lot of manipulation here compared to the rest of the country. So we're in a good place, and there still are not enough people that do manipulation that are even here and to support Maine. So.
Yeah. Thank you. And yeah, I see Morgan, I think that's you from Soft Corner Midwifery with the recommendation of Dayspring Integrated Wellness in Bath, and Nicole sharing that she refers to you and Dr. Keller, who's in Portland. And Dr. Keller was also part of a webinar we did in August about tongue tie. And so that was helpful to hear him speak about that. That's
and Dr. Keller, he runs the hospital OMT service at Maine Medical Center. So that's the service that I used to work with.
Excellent. And Lulu's recommending Doreen Kendall in Camden.
Yep.
Ginger, you have your hand up. What would you like to ask?
Yeah, I was just wondering if you do referrals to it.
Ginger,
Do you
you're
refer your patients to it? Oh,
something's going on with your audio.
Oh, I'm sorry, I missed that.
Yeah, Ginger, can you type that in the chat box? I don't know if it's there.
It sounded like she was asking if you refer your patients to WIC.
Okay.
If I refer my patients to WIC, there are patients of mine that are already established with WIC. I don't know that I've actually had to talk to anybody about becoming established with WIC. But that's a great reminder for me.
Yeah, excellent. Ginger, if you want to add something in the chat box for Dr. Mangalam to have and to maybe take some next steps there, because I think that's something that I know WIC is really trying to make sure everyone knows that it's worth asking patients if they're eligible and if they know about it.
Yes, I will. I definitely will do that. And I see somebody put Sam Medor in Belfast, and he and I worked together for a number of years. So he's a great asset as well.
Excellent. All right. Melinda, you have a question?
I just wanted to mention that I would encourage folks to seek this out in places you might not expect. I was referred for OMT for my migraines and was surprised that sort of randomly a family doctor at my local federally qualified health center happens to be an OMT. So it isn't something they sort of broadly advertise, but he has the skills and does perform manipulations. So sometimes it might not be someone specifically at a sort of integrative health type setting, but when you dig in, you might find someone that surprises you.
Excellent. Thank you. Other questions or comments? And speaking of being surprised, I know when I was at Maine Medical Center, I would often see this happening in the room where Dr. Keller or Dr. trying to remember who his predecessor was. His name is escaping.
Brian Beck.
Yes, Dr. Beck. And he would, just like we saw in the video, just very gently hold the baby's hand, head in his hands. And it didn't look like he was doing anything. It looked very magical. But it's helpful but then we could also see the results after, whether the baby filled his diaper after, or because sometimes that can happen, or the baby latched better after. You could see the results, and I think sometimes parents would be surprised and wonder more about what was happening. So it was really nice to see that explanation of like what is happening just with those like small movements that's being done. Thank you for sharing that.
Yeah, I wanted to thank you too, Kiran, because for like showing some videos that are a little bit more in the weeds, because Paula and I refer basically every infant we see who's having breastfeeding difficulties to get body work done with you or another DO, and we call it magic. And I never really understood what was going on. I now have a better understanding of some adjustments my own newborn has had. So thank you. And just wanted to encourage any of you who are seeing clients who are breastfeeding, chest feeding with infants who are struggling a little bit, to make sure you have someone to refer to in your area, because we've seen such a big difference. And now with our tongue tie clients specifically, we like don't even recommend revisions without having some OMT done first, because it can really shift the trajectory of how an infant is able to latch and be comfortable. It's really amazing.
Now, how do you feel about people calling it magic? Because are you like, no, it's actually science. Like I'm actually doing something that's scientific here.
I think initially I was a little taken aback by it being called magic, but now I fully accept that. Not that I'm doing anything magical, but it is magical that the body can, if given the chance, can change things. It can, heal itself. It can learn new things. That's the part that's really magical. I just end up being like a little guide that can do a little things here and there, but the changes, that's really what's magical, and that's wonderful.
I just wanted to add, sorry, did I cut somebody off? I work for Maine Families, so we do home visits. We visit families weekly or bi-weekly for sometimes years, and we're all CLCs. And I think it's good if somebody's going to share with a parent, like, maybe this would be something like you could look into, and maybe good to tell them that they may just have to go one time, because sometimes the barrier is families have this perception that like, oh, like we're going to start doing this and then we're going to have to keep doing it. We're going to have to keep doing it. I mean, even in the adult population, I think when you talk about like chiropractics and things like that, people are like, oh yeah, you're going to go, and then you're going to have to go every other week for the rest of your life. It's like, no, that's not really how it is. So I think if you mention it to a parent, sometimes we don't think about what those barriers might be, but they may be thinking, yeah, and then I'm going to have to keep going like forever. So just telling them like, it may just be 1 or 2 visits, and it could change everything.
Yeah.
Yes. And I would like to echo that and just say that if especially with lactation and breastfeeding, if you're not seeing a change in 2 visits or 3 visits, it's probably not the right thing for you. So it shouldn't be something that's this ongoing process. Some of these other conditions, migraines and things like that, maybe that might take some more continual treatment, but still, my firm feeling is that as little intervention as possible, because the body can do it on its own if it's in the right condition. So thank you very much for that.
You're welcome.
Andrea, along those lines, I think too, making sure that families know, depending on their situation, that I know, at least in my situation and families that I have experience with, it's been billable to insurance. So maybe not every insurance, I'm sure the doctor would know more about that, but I think folks are turned off very quickly if they find out it's going to be expensive, depending on the population, of course, but knowing that it's covered by insurance might make folks more willing to kind of take a chance with it as well.
Yeah.
Any other thoughts or questions? All right, so yes, we put your website in the chat box, so hopefully you all got to see that as well. And we will include your presentation in our meeting minutes, which are on our website. So thank you very much for that.
Yes, thank you.
Yeah, thanks for being here today and for sticking around a little bit. You said you want to stay a little bit to hear what everyone's up to. So thank you for that. And with that, we will switch over to, I'll share my screen again. The next part of our meeting, which is connecting the dots and new knowledge worth having. So I'll let Amanda take it from here, but first ask if you could all have your cameras on if possible for this part of the meeting where we can see each other. And this is the part where we're connecting a bit more and we are a little more interactive. So it's so nice to see faces. Thanks for being here. And I will stop sharing my screen in a moment, but I'll go ahead and put these questions in the chat box so you can see what you might want to consider. Go ahead, Amanda.
Hi, everyone. Amanda Powell, Vice President of the Maine State Breastfeeding Coalition. So like Kara said, she's putting in the chat right now. So this is where we just go around and it's a time to talk about things that are happening legislatively or things, new research that you've heard about. And what I think happens a lot is people talk about things that are happening within their work, barriers, that they can find solutions for. And this group seems to really help that out. So, or really, just celebrating wins. If there's anything you want to talk about too in that way. And I know that Melinda, you wanted to talk about some things with Help Me Grow. Did you want to go first?
Sure. I can do that. So I just wanted to put out there, I know some of you have already been at various presentations or events where Help Me Grow was discussed, but we're working to reach out really across a lot of systems here in Maine to make sure everyone is aware of this new resource. So we are a new resource of the Office of Child and Family Services, and Help Me Grow is new to Maine, but it's actually a nationally recognized program that is up and running in 28 other states. Maine is the 29th state to stand up a local affiliate of Help Me Grow. And so we are a central access resource for families of young children. So we support children birth to 8 and their families, as well as pregnant people. And we are here to help make sure that those families are getting successfully connected to the information, resources, and supports that they need in their communities. So if you're familiar with the 211 resource, it's almost like an enhanced 211 that's very focused on our early childhood population. And we offer short-term care coordination. So when families connect with us, we stick with them for a couple of months to make sure that they are getting successfully linked to whatever they need, whether that's WIC or a medical evaluation or a diaper bank. It could be any number of things, but that's what we are here for. We also offer free developmental screenings if parents are wanting to just kind of keep up on how their baby's doing developmentally. They can take those screenings for free right on our website. And we call them with the results and talk to them about next steps. So I just wanted to make sure to put the word out to everybody that we're here, we're ready to go. We're already serving about 36 families across the state. It is a statewide service, so regardless of location, we can help. And it's completely free. There's no insurance or main care criteria or diagnostic criteria. Basically, if you have a child birth to 8, we are here to help. So wanted to make sure folks are aware of that. And if it's something you would like for yourself or your team, wherever you are, to learn more about, I am happy to come out and give a more in-depth presentation, and we can have a discussion about what it would look like for your specific population. Example of that, Sam is here from WIC, as well as Ginger. And well, we might have lost Ginger to technical difficulties, but I'm doing some presentations for their WIC folks later this month to share how we can help support those specific populations that they are working with. So I want to make sure everyone gets time to talk. So I just wanted to share that. I can put our contact information and website in the chat. So if people want to learn more, you'll have that.
Thank you so much. Does anybody have questions around that for Melinda? You can put that in the chat and follow up. I actually also work at Maine Health, where I am right now, in the child health department. So that's something I can share with them.
Yes, so I've been working with Angela Mowat and Sam Hero. So we're getting the word out to a lot of avenues at Maine Health. So the more you can spread the word, the better. We're trying to these big hospital systems, as you all know, can be tricky to figure out where is the kind of right place to talk and make inroads. So we're working on it. Thank you.
Yeah, Angela's right over there. So yeah, that's great. She's in my department.
Maine truly is a small world.
Truly.
Well, I'm at Northern Light at Eastern Maine, and I will take down your information because I'd love to have something for our patients that we could, when we do discharge, that we could give them that information.
Absolutely. And if you connect with me, I'd be happy to do a mailing. I could send out a big packet of our parent postcards that could be given out. I just met with the pediatric services line at Northern Light this morning. So we're starting to make some connections there as well.
Good.
Great. Thank you for all that. Okay, so I will go around, and it's okay to, pass if you don't have anything, but like I said, just talk about any barriers in your work going on that you maybe want to discuss, or any new research, any wins in your work is great too. So I'll just go around and start with Andrea. Do you have anything that you wanted to share?
I have nothing new that I can think of, but it was great hearing from Melinda, and I may reach out to you at some point to see if you'd like to join one of our staff meetings via Zoom. We like to connect with as many people as we can, so I'll probably be reaching out.
I would love that. What region are you in?
I'm in Fort Kent, so
oh, great.
I'm part of the Aroostook County team. So we have a Fort Kent office, Caribou office, and a Holton office.
Mm-hmm. I actually grew up in Littleton, so my heart is in Southern Aroostook still, and I would love to connect with your crew up there. Thank you.
Perfect. You're welcome.
Great, thank you. And then just a reminder to introduce yourself. I know you did earlier, Andrew, but when I call on you, if you can talk about any organizations that you're a part of. So next we have Nicole.
Sure. Hi, everyone. I'm Nicole Hart. I'm on the MSBC board, and I co-own Maine Mother and Company, where Kiran practices in Brunswick. We have a couple of offerings coming up, both for professionals and parents, that I just want to put in folks' radar. And I'm just pulling up our website because I am very tired and I want to make sure I get the details right. So we have a breastfeeding for professionals workshop coming up. The next one is mid-January, January 14th. And this is approved for CEUs for RNs. We're working on CEUs for lactation professionals. It's like two different things. It's very complicated. But if you are looking for kind of a chance to up level or refresh some skills, that even if you were already credentialed, Paula Norcott's teaching it. She's awesome. So highly recommend that. And I will put a link in the chat for registration. And then on the parent side, we are offering an infant feeding class at Maine Mother and Company. There is one this weekend. It's December 6th. So I guess that's not this weekend. That's in the middle of next week. And we want to be offering those more frequently if there's demand. So far, it's been kind of quiet, despite hearing from a lot of folks that they are looking for breastfeeding education, especially, folks who are in Southern Maine and can't get into birth roots classes, which are like consistently full, or who just want something more in depth than what the hospital offers. So if you have clients kind of within, I don't know, an hour of Brunswick, that's definitely something to check out. Paula's teaching that to start, and I imagine I will start pitching in later in the year with those two. So just wanted to put those on people's radars. That's it.
Great, thank you.
Yeah.
I put one of the links in the chat. I'm not sure if it was the correct one, but. All right, so next I have Rihanna. Do you want to go next? It's so nice to see you on here.
Hi, everyone. I know I've been meaning to get on one of these meetings ever since I moved, but here I am. So my name is Rihanna Plord. I am a registered dietitian and also certified lactation counselor. I used to work at WIC in Bangor, but now I live in Connecticut, and I just accepted a job at Connecticut Children's Medical Center. So I'm super excited to start there. I'll be working on a feeding team, and I don't know much about it yet, but they told me a little bit about their lactation services. They have a milk room, which I don't know if any hospitals in Maine have like a designated milk room. I didn't get to explore much in some of my clinicals that I did. But it seems like they have really good lactation support. I'm excited to work with other lactation counselors on the feeding team that I'll be working on. So yeah, I'm really excited. I'm also looking into trying to join the Connecticut Breastfeeding Coalition team as well. So yeah, that's a little bit about what I'm up to. I definitely always try to keep in touch with what Maine Breastfeeding Coalition's doing, and some of my colleagues up in Maine still. I did have some, oops, I thought I lost connection. I have a lot of friends or friends of friends in Maine who are having babies, and a lot of them have reached out to me, and I help them as much as I can. However, I did have a recent person in Bangor who had reached out she was having lots of issues with breastfeeding, and I could only help her so much over, Messenger on Facebook. And since I've been out of the area for a little bit, I didn't know if some people might have resources of other CLCs that would take on someone who's not eligible for WIC. I know Mitchell Coles had opened her own. I had referred this person to her, but I didn't know, does anyone have any other resources of where I could send? Because she wanted to do more of weighed feedings and all of that with some of her issues.
Cynthia says in the chat, please have her reach out to public health and nursing. It's free and there's no requirement around that.
Okay. Yep, that's right. I will do that for sure.
And then where is she based?
She's in Bangor, which you would think. I was just there working, but
our lactation at Northern Light will do weighted feedings and an outpatient lactation.
Okay, perfect. So she would just need to call and schedule an appointment.
Yes. Yep. And they're in person too. We're not doing virtual stuff as much anymore.
Right. Awesome. That's good to know too. Okay. Awesome. That's really helpful. Especially having this network to kind of keep in tabs with some people that might need help in Maine. So yeah, that's all I have. It's great to see everybody, and thanks for letting me join today.
Thank you. It looks like a couple people had to hop off. Is there anyone that needs to leave that wanted to leave early that wants to go next? Right, I will keep going around then. Next I have Carrie, if you want to introduce yourself and any updates you want to talk about.
Sure. So Carrie Louch, my pronouns are she, her, and I work for the main WIC state office, so based out of Augusta-ish area. And some exciting stuff for us. I'm gonna pull this up because I can't remember numbers off the top of my head. So when we started pulling our data for fiscal year 2022, we saw some really exciting growth at our initiation and duration rates that I wanted to share with y'all just to kind of celebrate. So amongst WIC families in 2021, we had a 78% initiation rate with breast and chest feeding. In 2022, we're up to 83%. So really excited about that. And then as far as folks that continue to breast or chest feed beyond the first 3 months of their child's life, in 2021, we were at 41%. And in 2022, we're up to 44%. So we're a small population in a small state, but still really exciting to see those numbers grow, especially with how much hardship we saw for families with young children with the formula shortage and the continuing effects of the pandemic. So huge shout out to our local agency staff for getting those numbers up. I'm also going to put in the chat one challenge that we're facing throughout the state right now is staffing. And we do have a couple of vacant positions, one of which is a breastfeeding peer counselor, which anyone that has any lived experience with lactation is welcome to apply. It is a part-time position, so it doesn't require a tremendous investment of time. It does require a minimum of 2 hours in person, and that is in the Augusta area. And then we're also looking for a nutrition counselor in Aroostook County, as well as in our mid-coast region, so Bath, Belfast, Rockland area. Unfortunately, that's not the links. So I'll work on getting the links and I'll share them in the chat momentarily. But anyone in your network that you know of that would be interested in working for one of our WIC local agencies, we'd love to have anyone, but especially folks that are tangentially related to being passionate about breastfeeding and chest feeding. And then the last thing is more of an opportunity for community partners that might be interested. Last spring, we started rolling out our new comprehensive breast and chest feeding curriculum for staff. It's leveled, and depending upon where folks fall, administration staff, they would fall at level 1, which is less time. Our coordinators and our directors fall at level 4, which is a much greater time commitment, as I'm sure they can tell you. So it's between 1 day and then 1 full day is level 1, and then all the way up through level 4. But now that all of our staff has been trained or will be trained here next Tuesday, we are going to open it up in the spring to anyone that would like to attend. It is a general overview of breast and chest feeding, as well as how WIC works. So kind of explains the different positions, how folks can qualify for WIC, our food benefits, all that good stuff. And then as it progresses, it does get into more complex dyads and all that good stuff. So we're at least opening level 1 up to folks in the community that are interested in attending. If there's interest, we'd love to have you for levels 2 through 4, however high you'd be interested in going. And as of right now, we are offering CEUs and it's free to attend. So I think level 1 is about 7 hours. So quite a few CEUs for folks that may need it for certifications. So if you are interested in attending, it is in the spring, so it's pretty far off still, but I'll put my email in the chat. If you just want to let me know that you'd like to be forwarded that information when it becomes available, be more than happy to share that. And now I'll stop talking. Thank you.
Thank you. We'll actually have a question for you. I know Ginger said earlier in the chat that she's sending 3 million back in unspent food funds this year, and really to talk to everyone about WIC. Can you just quickly remind people how to get people signed up for WIC? And I think a lot of people forget that it can happen as soon as you're pregnant, you can be on WIC.
Yeah, so as soon as we have confirmation of pregnancy, we are more than happy to get folks enrolled in the program. But if the parent, has delivered more than a year ago, or if they're not breast or chest feeding longer than 6 months ago, we are happy to enroll any children that qualify under the age of 5. Don't worry about income or any of that good stuff. Folks that might be over income but receive SNAP or TANF or on main care, they are automatically income eligible. So even if they are earning higher than our threshold, they could still be eligible. So send them all our way and we'll figure it out on our end. If you are near a local agency, we have 8 throughout the state. If you're near one and you happen to have a relationship with them, you can have them contact those folks directly. Otherwise, you can send them to our website, maine.gov/WIC. There's a contact button that sends an email directly to myself, Sam, who's also here, and one other person on our team. We see it and we forward it immediately to the local agency that's nearest to the individual where they live or where they put as being where they're from. But yeah, so I think we're getting about 60, and Sam, you can correct me if I'm off on this, 66% of folks.
Yeah, about 66%. And another avenue for referrals, which I'm sure most of you are familiar with, is the Cradle Me form. I know that it's always in a constant state of being updated and edited, but we do get those. And just so you know, we do send any referrals that we get almost immediately. So as soon as we get it, we send it to the local agency. Local agency usually reaches out within 24 hours. So it's as immediate as possible.
And we're missing a lot of 66% that's great. That's a lot, but that means that 33% of folks that would otherwise be eligible to receive the food benefits, the referrals, the support, aren't being connected. And we know that WIC asks a lot of folks, sometimes more than what other support programs might ask with the appointments and all of that. But, we know that the health outcomes are better for kids that receive WIC. So anyone that you can send our way, we'd love to have them.
Thank you so much. All right, Grace, would you like to go next? And thank you so much again for helping us with social media and other things like that. I really appreciate it.
Yeah, I don't really have anything to share, but I'll introduce myself. My name is Grace Cook. I am a new doula in Maine, and I live up in the Bridgeton area. And as Amanda and both Cara mentioned, I'm helping out a little bit with the social media for MSBC. So yeah, it's just good to be here. I don't have any news, but thanks everyone.
Thank you. I'm also a doula, so yay. Doulas. Okay, Shauna, would you like to go next? Introduce yourself and anything you'd like to talk about?
Hi, I'm Shauna Goulet. I'm a labor and delivery nurse at Eastern Maine Medical Center, but my home is in Masardis, so I'm up near you there, Andrea. I'm up in the county when I'm home. I'm currently working really hard with my childbirth education group at Eastern Maine, trying to get our classes back in person, but at least we have split our classes a little bit so we get to spend a little more time in Zoom format with our patients. And actually one of our IBCLCs has actually decided to start offering a class on a Saturday. So I think we'll get even more clients that way too. So it's a struggle always. I wish we could be in person. I wish we could get our breastfeeding support group back in person. I think that's one of their goals for this spring, but we're still struggling with having the space in order to do it and having the hospital let us bring in little ones. But it's just one thing at a time. But one really good thing is I'm also the Maine State A1 section chair. And we had a meeting the other day and we're working on setting up a conference convention in spring of 2024. And one of the big things that we want to try to do is it always seems like it's a lot of labor and delivery things included in that conference, but we really want to bring more focus to the newborn and NICU side and try to do like one day that's more labor and delivery. And then the next day, more newborns and lactation and NICU. So be aware, we'll be reaching out to some of you when that gets all organized.
Great, thank you for that. Jen, I saw you lift up your camera earlier and you had a beautiful Christmas area behind you. So that, that was great, but you can go next if you're ready to talk.
Me, Jen?
Yes, you.
Oh.
You like you
I'm like, what
rearranged
did I
and there was
do?
like
Oh, I must have went. Yeah. Oh, there,
beautiful
right
trees
there.
behind you,
Oh,
yeah.
okay. Yeah, I have 3 trees. Every year my husband's like, what are you doing? I'm like, no, it's good. It's good. So as far as it goes, Carrie did such a great job. I feel like, we're just plugging away. We're trying to see as many participants as we can. Like she said, we get the referrals, and as soon as York County gets the referrals, we are scheduling those participants as fast as we can. Some of our appointments, they are mostly over the phone, but they can be in person if a client wants to come in and a parent wants to come in to have their baby weighed. They can bring them in for an appointment. So because we are over the phone, we probably have time that day once we get a referral to complete an appointment, or at the client's earliest convenience. We accept walk-ins, lots of stuff. So we have been doing that training that Carrie has also mentioned. I think our last day is next week. So that's exciting to be wrapping that up. It was, I want to say that I went to the training 4 years ago to do this curriculum. It was when my son was in the 8th grade and he's now a junior. So it's interesting seeing the training that I did that many years ago to now be in fruition and actually doing the training. So that's where we're at right now at York County. I think that's about it for us.
Great, thank you.
Thanks.
And that's really impressive with the 3 trees. That's great. My family owns a Christmas tree farm, and I just went there. It's in Waldoboro, and I just went there and cut mine down last week, so it was exciting.
Oh, see, I'd have 4 then.
All right, I was just gonna call on you, Morgan, but it looks like you have to go. Yep, okay. She just left. That is fine. So Morgan Miller was the soft corner midwifery person on, and her exciting news is that their new birth facility in Bath is open, and she put a link in the chat, so that's super exciting. Everybody wants to check that out. All right, so next I have Sam. Did you want to give any updates and introduce yourself?
Hi, yes. Well, Carrie covered most everything, but I'll just introduce myself. I'm Sam. I'm the nutrition coordinator for the Maine State Agency. I guess one update that was not mentioned, it's a little bit more of a programmatic update. We received a grant from USDA FNS for some extra employees for our clinics with a more diverse population that are non-English speaking participants or English as a second language participants. And the grant is allowing us to provide additional staffing at 3 locations, 2 staff for 2 locations and then 1 staff, I think, for the 3rd. And they will be able to help with things like certification appointments, shopping experiences, but it will just be a nice addition to our team, and to be able to provide services that for multilingual staff members, rather than having to get an interpreter on the phone or having an interpreter come to the clinic if that's what they want. We'll be able to have somebody staffed right there in the office. So we're really excited about that. But other than that, that is the only update I have. And thank you for letting me join today.
Great, thank you for that extra update. Okay, next we have Lulu. Do you want to introduce yourself and talk about anything?
I'm in my mobile office. I hope that's okay. I'm Lulu. I am in Camden up here on the Mid-Coast. I am a certified lactation counselor. And I also recently started Nature's Hand, which focuses on lactation care and management. But I'm hoping in the future to add toddler and childhood nutrition certification, as well as some doula certification as I go. But right now I really want to do well with lactation, so I'm really putting my energy into that. One of the things I've done is I've started the Mid-Coast Nursing Circle, and so far I have 4 locations. I have one up at the Belfast Library, one at the Rockport Library, one at the Camden Library, and then also in Rockland at the Good Turn Co-op, which is not a traditional space for this sort of assistance, but I'm also about visibility. So I'm trying to both create a sense of community for those who are immediately involved, as well as involve visibility to the greater community. But yeah, I'm interested in trying to be as helpful as possible to those who show up, as well as try to create an opportunity for the embodied knowledge, which we all know is the most effective way to promote and support breastfeeding on the ground level.
That's great. Those are all really, those are really amazing, impressive things, having 4 locations. I grew up in Thomaston, so it's exciting to hear about that. Yeah, does anybody have any questions about it? Or? Great. Yeah. Well, if you have, I know it can be hard on the phone, but if you have any links you want to add into the chat, you can do that. But thank you very much for sharing.
I'll try. Thanks.
Okay. All right. So next we have Brenna. Would you like to go introduce yourself and any updates?
Sure. Brenna Nelson, breastfeeding coordinator, registered dietitian in CLC for Maine General WIC. I think Carrie did a great job as well summing up the WIC program. We are still looking for a peer counselor to work within our office, and we do, I believe, have another nutrition position open as well. And then I think just to add with the participation that Carrie mentioned, pretty pleased with the initiation rate that Maine General has been experiencing. I think our last one for October was like 100% or close to that, pregnant women that were on the program initiated breastfeeding. So we're pretty proud of that. So yeah, I think that's the only update at this time.
That's great. Thank you for that. All right. And so next we have Lynn.
Hi, yep, I'm Lynn Taus, and I'm one of the OB nurses at Penn Bay Medical Center and an IBCLC. And we have just started back up our in-person support group for nursing mothers. And I've heard from the mom that came to my group that about Lulu's group at the library, and so that's very exciting. We here at the hospital are limited to only 7 moms with babes in arms because of COVID restrictions and room space. So moms have to sign up through CoreStorm Journey to Health. So it's a bit of a process, but we're just getting started. So far, I've had 2 moms, and so I'm excited to at least be back in person, because Zoom was not a thing for these moms. And we bring a scale so moms can do pre and post weights and track their baby's weight if they want to. It's certainly optional. But yeah, so Lulu, I think that's lovely to have you starting up those groups as well. And I'd love to meet you sometime. We need to meet at Rock City or something, because I live in Lincolnville. Another thing I wanted to bring up that I recently watched on the website, the US USBLC, is that the lactation consultant website in the United States. Anyway, Suzanne Colson and biological nurturing, which I'm sure everybody knows what biological nurturing and that laid back position for breastfeeding, but she brought up, it was really fascinating, her research behind that. And so if anybody has an opportunity, I really encourage watching her thing. And she especially, but it was very spoke to me as being in the hospital, where she says, for the first 3 days, her quote is, keep your baby at the right address during the day. So keep that baby's cheek right against the mom's breast. Whenever as long as she's not sleeping, eating, or in the bathroom. So I'm going to be passing that on to my coworkers, and we'll see how that goes, and see. But also she talked about, she just made me question about a lot of, the lead with the chin is not always a thing. So, which is something, just whenever I get to the point where I like, oh yeah, this works really well. And then somebody else comes along and says, no, you don't need to do it that way. So yeah, that's how that goes. But yeah, that's it.
Thanks for sharing. Yeah, those are some good mottos to pass along. All right, so, and Kara put it in the chat too. I'm assuming it's that webinar you were just talking about that she put in the chat. So next we have Erica.
I know. Hi everyone, my name is Erica. I am the breastfeeding coordinator for the Bangor WIC. So just kind of bouncing off what everyone said, Carrie gave a lot of great updates about just like our initiation rates, duration rates. Just we currently actually just looked at ours in Bangor yesterday and they're up just like everywhere else. I think the initiation rate last year was like 76%. It's up for just Bangor in general is 82%. So that's great to see. Not too many more updates. Actually, something I did want to talk about is our location, our Bangor location. We have our social media platforms, which we have been trying to be quite active on. And our TikTok, we actually recently made a TikTok that went over kind of all of our breastfeeding supplies that we offer through WIC, and that it blew up. I mean, it has hundreds, thousands of views now and likes. So that was great to see. It was kind of a learning experience, as well as this TikTok hit like, multiple different states, and a lot of people were like, our WIC doesn't offer this. So it's great that it's not great for them, but it's great for us to be able to offer these to our main participants. So that was a big thing. We try to just, be active, since that's a big platform for a lot of, thanks, Rihanna. Rihanna started our TikTok, so I'm very proud to be able to keep it going for her since she has left. But yeah, that's kind of the biggest update we have here.
Yeah, congrats on going viral. It's very exciting. All right, so I encourage everyone to check out the Bangor WIC TikTok for sure. I don't know, Erica or Rihanna, if you want to put it in the chat. And we have Miriam next, who is one of our great board members, along with Nicole. If you want to just introduce yourself and talk about any updates you have.
Sure. My name's Miriam. I don't have any updates. I'm on the board. I have a upset toddler who's running around behind me. But yeah, just excited to see everyone here, and hope everyone had a great holiday and is moving into a great holiday season. So
thanks, Miriam. Okay, so anybody else have anything else to share? I'll give back to Kara. I know she has some updates on paid leave and other updates in general, but if there's any last things from the group. Okay, I'll pass it back to Kara.
Great. Thanks everyone for sharing. That was really excellent to hear. I tried to put as many things into our shared document that I'll put in the chat box again. If you want to try to revisit some of the things that people shared, you can go to that document. I have a question for the folks from WIC who are still here. Those increases in rates are significant. Like, that's really exciting. And I'm wondering if anyone has any theories as to what happened. Was it COVID? Was it an increase in support? Or was it an increase in awareness? Like, what are some guesses?
In my personal opinion, it was no formula.
Yeah, I was just going to add, unfortunately, I think the formula shortage really hit us hard.
Parents, I feel like parents that were on the fence, that weren't really sure what their plan was, I would encourage them to go to the store and see what was available, and nothing was available. And so they got nervous, which, I mean, I'll take a win as a win.
Yeah.
A win is a win for us. So I think that, and the duration part of it, because we're months out, more formula is available. People are sticking with it, which is awesome to see. We do offer a lot of support. And so I do feel that the limits of the amounts of formula that were available kind of swayed people that were on the fence. People that were going to formula feed were going to formula feed regardless, but the people that were going to breastfeed, chest feed, I mean, I'm sure you could, the other agencies might have, you know, a difference of opinion on that part of it. But.
Okay. Thank you. Yeah, that's good to know. So like short of another recall, which we hope there won't be more recalls, right? What else can we do as a community to kind of keep that going? And
I think one thing that I've noticed going around to the different agencies throughout the state that they all just do such a beautiful, wonderful job of is reinforcing to parents that any amount of human milk that they're providing counts. You know, there's a lot of folks that think, oh, I'm pumping, I'm not breastfeeding, or, oh, well, I only do it, you know, every other feed, so I'm not really chest feeding. But getting folks to know that any amount is great, any amount's better than no amount. And, you know, obviously we're all really passionate about one thing because we're all here, right? But you know, supporting families regardless of their feeding choice and just helping to educate, and you know, any incremental progress we can make. You know, maybe they won't nurse during this pregnancy, but maybe they will on the next one, and just continuing to provide that support and meeting them where they are.
Mm-hmm.
I completely agree with Carrie with that one. A lot of conversations I have prenatally with moms when they come in for their appointments are really combination feed is completely an option. So many moms, you know, and not everybody, but a lot of moms, you know, they think it has to be all or nothing. You're either breastfeeding or you're formula feeding. But I love having the conversation with families. It's not all or nothing. You can, if you need to, you know, use formula once a day, that's completely fine. If you want to use it every other feed-in, like completely fine. Any bit of, you know, breast milk is fantastic.
Mm-hmm. Awesome. Have you had any parents talking about the AAP recommendation and how it changed? It went from 1 year to 2 years. Has anyone had any conversations, or have any families been saying what they think about that, or if they have any concerns about meeting that goal now?
I've had one participant, I think, that was kind of having a lot of negative feedback from her family members. So when she heard the recommendation, she was kind of elated and relieved to be like, well, this is what they are now encouraging, so you can kind of back off kindly. So that she felt supported, which was really nice now that she has that accommodating for the recommendation behind her as well. I just wanted to add with Erica, the conversations have been with prenatals. A lot of them are on the fence of like, well, what if I have to supplement? What does that look like for WIC? And I think the conversations have been really great amongst, I can only speak to my team, but great in saying that we're here to support you no matter what your needs are, but really promoting breastfeeding and adjusting the food packages to meet your breastfeeding goals while feeding baby appropriately too. So that relieves a lot of the stress, and they're like, oh, okay, so I can do both, and this is what it will look like on the WIC program, talking about food packages, the initiatives, and all that stuff. So
I feel the same with in York County, that when a mom hits one, or when a parent hits one, and that magical birthday happens, and you know, other support partners want them to wean. I feel like, you know, saying, hey, well, the World Health Organization and the American Academy of Pediatrics recommend 2 years. So it's always beneficial for breastfeeding. I don't necessarily bring out the 2 years at the beginning, because when a mom is 2 weeks into it and it's overwhelming, every day is a gift. So like as they get older, we'll talk about the 2 years.
Mm-hmm. Yeah, that's helpful. I mean, that's the kind of conversation I was hoping to have, and just to hear from you on how you're all using that information now. So maybe, I mean, in prenatal classes, that might be appropriate to share what the recommendations are. I think a lot of us have in the past. and continue to share the recommendations, and that's part of it now, but it might not be the time to share it when they're struggling at that 2-week point. But certainly reminding folks, I love that example. I think we all know of folks who have been given a hard time by family members for continuing to breastfeed past when they did or when they thought it was appropriate. So this can be really helpful for that. Yeah.
I just wanted to say a couple things regarding both of those, which I think I love that we're talking about this. This is why I miss all these meetings. I think I'm such an advocate for it, and I sound like a robot and everything, but social media, I mean, with Maine Breastfeeds page or any of the WIC, agencies, I don't think that has a huge impact on the increase, but I think it has a minuscule impact, which is good in itself, because there's just so many young, people who they're constantly on social media. And now, like with my profession and everything, like being a CLC and an RD on TikTok, when you start liking things, it has an algorithm, so you start seeing more videos. So I'm seeing more videos of breastfeeding moms and all of that, and how they might be breast or chest feeding a toddler, and you see the comments and people, there's a lot of negative people in the world, and they'll comment on it. But I saw one video recently where a mother was breastfeeding her maybe 2-year-old, and she was able to educate people who are leaving negative comments about it, and by citing the new recommendations for the 2 years. So I feel like a lot of people, that had hundreds of thousands of views on it. So I was able to educate a large amount of people, which I think is great. So I know this is kind of spanning out of Maine or, New England or whatever, but it's still getting so many messages out there just by social media presence. It's such a huge platform. So yeah, so just even outside of WIC or the state of Maine or whatnot, it has such a big impact. So that's just my personal opinion on that. But
yeah, it's a great reminder. And I think not everyone who's supporting breastfeeding, chest feeding families are using social media, but almost every breastfeeding or chest feeding family is using social media. Does that make sense? So it's those of us who are not in that same generation so much anymore. It's good to be reminded that that is where, and we probably already know this, they're getting a lot of their information and their support is in that avenue. Yeah.
Definitely.
2 different people sent me this New York Times article that came out yesterday. Did anyone? I haven't read it yet, but I'm anxious to, because it looks like it's good. And I just tried. Here's the link, but when I tried to open it on my computer, I think you need a subscription, and I do have a subscription to the New York Times digital, but I think I can gift one. But anyway, I'm not able to find that. So, has anyone read it by any chance? Can anyone give the kind of the gist of it? I think we know the answer to what it really takes to breastfeed a baby for those of us who are working with families or are parents who have done it. But that looks, anytime there's an article like this out there, I'm always a little nervous about what the message is. But I think that it can be really helpful if it's really raising awareness about what the reality is. Either way, that's always a good thing. Any other thoughts on those topics? So great to have this time to talk about these things. All right. Yeah. Shauna saying, gave her daughter the extra support she needed to continue more than just family support to have those AAP recommendations. Yeah. Finney is now 15 months and running all over chatting at the storm. That's awesome. Exciting. All right. Well, I'm going to share my screen again so we can take a look at that document and see, first of all, a belated thank you to our annual sponsors. We have a tiered partnership, annual partnership that we have done since this past July. And so we want to recognize our patron sponsors in particular: Maine Health, Barbara Bush Children's Hospital, and Let's Go, Maine Mother and Company, Soft Corner Midwifery, Remedy Pediatric Sleep Coaching, Acceleron, and Dirigo Pediatric Dentistry. So I want to recognize them. We do have our meeting minutes and our recorded meetings. I believe a link should be on our website as well. I put in the biological nurturing webinar. Thanks for sharing that, Lynn. That's a good reminder. There are so many continuing education opportunities out there, and we just have a couple of them here, but we want to continue to share those because there's always something new to learn. And I love that we're all continuing to learn. So the BEST conference, they offer an independent study module that you can access until Wednesday, December 21st. There are CEUs involved. Their conference is May 11th to the 12th, 2-day conference. It'll be virtual again next year. If you have any research or any other resources you want to add to this document, please do. Our website is there, a resource library. We're going to be taking some steps to try to make that page a little easier to navigate, but there's a lot on there. And we're also considering adding some sort of a resource directory, which we've kind of played around with in our minds for a while and tried to figure out the best way to maintain a resource directory. But it seems like, it's come up a couple of times today already in this meeting, and like, where do I go to find someone who could visit this mom, or where they could bring to have their baby seen. So we're going to continue to work with that idea. I kept these feeding clinics on here from the last meeting. I don't think Nicole is on anymore to give us an update on that. And some other things that were shared last time.
Yeah, I just wanted to mention, when you say resource directory, it always perks my ears up. Okay. So I know we're actually working with a resource directory, Find Help, that Maine Health and Northern Light both utilize. And I'm just as a thought, I wonder, you may have already discussed it, but about the value of perhaps encouraging all the providers to be putting a free listing in Find Help instead of creating something new from scratch that might take a lot of work for your crew.
Yeah, I appreciate that reminder. That came up the last time we talked about this. So I really appreciate that, Melinda. Thank you. I'm making a note of that. And it came up recently. Kim isn't on here anymore. And Erica, you're in Bangor too, right? If I'm remembering.
Yes, I am.
Are you part of the Bangor Breastfeeding Coalition?
Yep.
Okay. Do you want to share a little bit about, I know that Kim put in the chat box about a Facebook page. Do you want to share more about that?
So with the Facebook page, the idea behind it is that we have one area where people can look to see all of the support per se. It's still kind of in the making. We weren't sure if we wanted to put like recommendations on there, information on there. It's kind of, we were like, should we? Because it's like, who's going to be posting? What credentials should you need to be posting information, stuff like that. So I believe that what we decided though, what we want to do is just have a Facebook page that goes over local resources within the area, what you need to be on, like for WIC example, what are the requirements, to be part of that, and also like how do you get signed up for that. So that's kind of what the Facebook page is going to be. We just want people to have one area to look where they can look for other resources that they may need.
Great. Yeah, so it might be worth rounding up with Kim about the Find Help resource directory as well. That might be something to utilize.
Yeah, that definitely sounds good.
Yeah. Okay, awesome. In terms of legislative updates, I haven't updated this page. Actually, this is from last time, but as Hannah Lord mentioned, that the paid family medical leave got 51,000 signatures on election day. So that was the ballot and for the ballot initiative. So to go back a little bit, there is still a paid leave commission that is meeting to review a plan to put forward to the legislature so that the legislature can consider passing a bill related to paid family medical leave. And if that happens, excellent. If they don't pass it for whatever reason, then there would likely be a question on the ballot in 2023. So there should be enough signatures that are being collected by the end of this month to be able to put that question on the ballot. So it can be a referendum, a place for people to actually vote themselves when they go to the polls next November. So it's all looking really optimistic. I think that a lot of folks who've been working on this are cautiously optimistic right now, but stay tuned for more information. And there's always opportunity for more storytelling around this topic and advocacy with your own legislator. Shauna, please send me your resource, anything that you have on this topic, if that's what you're talking about.
Yes, ma'am.
Yeah, please. Thank you. Let's see here. And then I tried to put in all those job opportunities that were posted in the chat. So thanks for doing that. I'll try to get those into a newsletter at some point as well. So just know that that is something that we can help with, is putting some job postings out. And then I tried to capture some of the other things that were in the chat. And then before we kind of wrap up the meeting, even though it is that time already, wow, we've timed things pretty well. Any other questions or thoughts that you want to put out to the group? All right, well, you might be looking at my screen trying and reading this. So next year, as you've seen, I think I mentioned this at our last meeting, and I put it in the last couple of newsletters. We will be shifting our meeting format next year so that we will have something every month during the lunch hour. So for 1 hour. And the even months, we will have educational webinars. And I am waiting for confirmation on the February webinar. I'll let you know about that. The April 6th webinar will be on workplace law and helping to answer a lot of questions people have about when people go back to work. What are they, what are their protections, really, state, federal, and beyond. So that I think is going to be really interesting. And we are always looking for more topics. So if you have any suggestions for topics, anything that you would like to learn more about, please type in the chat box, and we will do our best to find speakers. If you have recommendations for speakers, please let us know. And you can always email us at mainbreastfeeds@gmail.com. And then on the odd months, starting in January, we will have this second part of our meeting that we are in right now. That is what the focus will be in those meetings. So it'll be, again, during the lunch hour, and this will be the focus. People will join expecting to have this kind of connection and networking time and sharing time. So we hope that you will join us for those as well. And we hope that that 12 to 1 o'clock time is going to be doable. I think we see that 2 hours can be a bit of a long stretch sometimes in the middle of the day. So we will do that. May 4th, we'll focus that time on an annual meeting, which will be a report out from us. Will be the first half hour essentially on what's going on with the Breastfeeding Coalition. And the second half hour will be this connecting the dots portion of the meeting. And in July, we hope to host and have an in-person gathering somewhere so we can try to all come together and see each other's faces in real life. And yeah, so any questions about that? These are other things that we've mentioned already. The Global Latch On is scheduled not for World Breastfeeding Week anymore, but for April 7th and 8th. And so that's good to keep on your radar. If you've hosted a Global Latch On in the past, know that the dates are changed and you might want to start planning something for those dates and let us know how we can help with that. The BEST conference and then the next Patchwork of Parenthood storytelling event. What else? Are there any other dates you have on your radars of different events that are coming up in 2023 that you'd like us to help promote? All right. And any topic suggestions or speaker suggestions? Let us know. And I think I see Layla is here. And Layla, I don't know if you were able to introduce yourself earlier. So we have a few minutes if you want to introduce yourself and share anything that's going on in your world. You can also use the chat box if you're not able to unmute or speak. All right, anything else from anyone else here? Thanks so much for hanging in there throughout this meeting and for taking the time today to connect and learn. And if there isn't anything else, we'll look forward to seeing you on January 5th for another time to connect.
Thank you, everyone.
Have a great weekend.
Bye.
Thank you.
Thank you so much.
Thank you.
Get to my controls.